Chapter 15, Therapy. Ways of treating psychological disorders. There's three different categories of modern Midwestern therapies: psychotherapy, biomedical, and eclectic approach. Psychotherapy is the treatment involving psychological techniques for people trying to overcome psychological difficulties and are trying to achieve personal growth. Biomedical therapy is prescribed medications or procedures that act directly on someone's physiology. For eclectic approach, is uh, is the approach to psychotherapy that uses techniques from various forms of therapy, so it kind of mixes and matches all of them to do a good job on it. There's also psychoanalysis and psychodynamic therapies. And Sigmund Freud's therapeutic technique helped to form the foundation of psychological disorders and how to treat them. And some goals for psychoanalysis are like energy release, conscious awareness of repressed feelings, insights into origins of where these disorders could have come from and how to reduce them. Also, the reduction of inner conflicts. Some techniques is like historical reconstruction, resistance, interpretation, and transference. Some goals of psychodynamic therapy are to understand the symptoms by focusing on relationships and explore defended against thoughts and feelings. There's also some humanistic therapies, and the goals of that, the goals emphasize innate potential for self-fulfillment and through growth of self-awareness and self-acceptance, and this seeks to reduce inner conflicts that interfere with natural development and growth. Another form of therapy is active listening. And ways that you can active listen is to paraphrase, like kind of re-say what they were saying to make sure that they know you were listening. Invite clarification, so like ask questions about it, and reflect your feelings about the subject that they're talking about. And there's also some behavior therapies where you can assume behaviors are the problem, apply learning principles to eliminate unwanted behaviors. Cognitive therapies that teach people new, more adaptive ways of thinking based off the assumption that thoughts intervene between events and over emotional reactions. Beck's therapy for depression helped to reverse clients' negativity about themselves and their situational and their situations and their futures. And ways that they would do it is they would use like gentle questioning to reveal irrational thinking about one person's self. There's also cognitive behavioral therapies, and which include training a patient to practice a more positive attitude. Group therapy, which is similar to an individual but performed in like small groups. There's family therapy, which helps people to see the difference in self versus family, connecting with family members' emotions, so connecting with your family on their emotions. Psychotherapies, they're effective, but there is no one type that is effective more than the other. It just depends on like how your brain is. Certain ones work better with different people. And some of them are better at like treating anxiety more than others. It just kind of depends what you have going on.